I think the recording started.
All right, great. Thanks for that. We're gonna start the meeting. I saw an email from Joel saying that she will join the meeting, but she may be a few minutes late. And just to say that I co-chair this meeting with Joel Carroll, who is the managing director for the Enfield division. So I sent the agenda sometime last week, so I'm hoping you will have seen the agenda, but it would be helpful, I guess, for us just to share that on the screen. So I'll start with just a second, trying to just get my papers right here. Just a second. Right, so for today's meeting, we've got a number of items that we need to cover. So the first one would be we just need to review the terms of reference, and I'm hoping that we can actually agree the terms of reference today. I see Joe has just joined. Hi, Joe. Hi. And then we need to look at the priorities for this year, and what we're hoping to do is to agree those priorities today. And Samina, I think you're going to give us an update on the state of inequalities report, and as well as the action plan that links to that state of inequalities report. And also we need to discuss service user involvement, expert by experience and service user review, and of course the PICRIF. It says the service user film and updates. Can I just check who is leading on that? I've got CC on that item on the agenda, so if you could just let me know who is leading on that particular item, that would be great. Samina.
Thank you, Chair. I was just going to say, as part of the action plan, which I'll be sharing later, there was Natalie provided her feedback on it, and there were some areas that she felt should be the role of this work stream. So it'll be up to you whether you want me to do that before you set the priorities and the terms of reference, or after. So I'll leave it with you to decide.
Yes, so happy to move that agenda item, so we could start with that, but I would really want us to get to the priorities today, so we need to make sure that we cover that, but that's fine, so I can arrange the order of the meeting. Joe?
Oh yeah, you've got me and Georgia down to do something on EVE and service user overview. I see Georgia's not here, and we're both in a meeting at 1 o'clock, so I'd need to leave early. So if you want to bring that forward, or we can do it next time, whatever you fancy. I wasn't aware that we were scheduled to give an overview, so.
Okay, that's fine. It looks like you're all ready to give us that overview. So yeah, let's see if we can move things around. So that's fine. Thanks for that. Okay, so yeah, so minutes of the last meeting. I'm not going to share the minutes of the last meeting on the screen, but for those of us who were around at the last meeting, could I just check for any accuracy, anything that you think needs to be changed, added to the minutes of the last meeting? All right, if not, then I take that these are accurate, so happy to approve the minutes of the last meeting. I've got an action log that I need to look at, and Jadel, I'm just wondering whether you're able to share the action log on the screen for me. You just, I can see you in front of me right now, so I can, if you don't mind just sharing that, that would be great. Thank you. Yeah, I think the first action really whilst you're trying to share that was around the terms of reference. So we will look at the terms of reference today and hopefully approve those terms of reference. The next action after that was, yeah, I'll leave it to you. Right, thank you. It was around trauma-informed care, and was that an action for Eddie, if I'm not mistaken? I think to send information to all and have a slot at the next meeting agenda. Now I'm just thinking this action dates back to June, really. Have we already covered that? I think we had a presentation on trauma-informed care, so I think we can close that action if that's okay. And service user representative, we're going to discuss that today, so that's fine, that's on the agenda. Number 12, the states of user involvement.
So Samina was attending the MD's meeting, which I think went ahead.
Okay, so that's all been completed. Thanks for that. And I think he also attended POMG. I wasn't at the start of POMG, but
yeah, I'll be regularly at POMG going forward as well. So thank you.
Okay, that's fine. Thanks for that. And I think we'd agreed that all MDs throughout the boroughs will be copied into this meeting invite,
Yes,
which is great. I can see Gary is on the call, and I can see also that other MDs are on the invite, even though they may not have been able to attend today.
And the next one's the draft priorities, which were sent out for comment.
Yeah, that's fine. We got those on the agenda as well today,
Yeah.
so that's great. EBE service user overview. We've got that on the agenda, but this action is to organize a separate meeting to discuss in more detail around service user and carers involvement, and to be added to the agenda of the next meeting, which is this meeting. So that's on the agenda. So great, thanks for that. Number 16, which is to do with PICRIF. That's on the agenda today, so I'm assuming that will be covered today.
Yeah, Chair, that will be covered in today's agenda.
Okay, thanks for that. And then number 17 is preparing expert by experience for their contribution to meetings and work streams. GB and JA have been tasked with preparing a program outlining what we are asking for regarding service user involvement, and that was to be done before the 2nd of October. Has that been done?
Georgia's not here.
Oh, sorry.
Jordell?
Yep, so I've been contacted. It might have been a separate one. Sorry, GB is
Georgia? No?
Georgia's GR, Georgia Robinson.
Okay. Don't know.
Well, I have been contacted by. Oh, sorry.
Oh, sorry, just checking. Who is GB? Do we know? And who is JA? Sorry for that. I'm just trying to look at the minutes of the last meeting. Don't think I can. Right. Jodel, could I just ask you to just get some clarity on this action if you can, and then give us an update after the meeting? That would be fine. And number 18 was update from Joel. All group members to review the list of priorities. So we got the priorities today, so that's fine. And then the state of inequalities report.
Yeah, that was done.
That was done as well. So thank you for that. And the rest of the other actions are closed actions, and they're all rated as green. So thank you very much. We can move on to the agenda for today's meeting. Right. Do we have the terms of reference? I mean, I think they are attached to the agenda.
There's been no more feedback. All the feedback's been incorporated. However, we were a bit concerned that the priorities were getting bigger and bigger and bigger and bigger, and as we raised concern at the beginning with Samina, by Samina really is about making sure that we have enough capacity to complete the priorities, and they need to be tangible.
Yeah, so the priorities that we've got on the agenda, Joe, just to clarify, would be the priorities that needs to go into the terms of reference.
I'm sorry, I keep losing the connection. I didn't hear what you said.
So we've got a list of priorities for 2023-24 and then 24-25.
Yeah.
Are we expecting some of those priorities, if agreed today, to go on section 3 of the terms of reference? Can you hear me, Joe? Sorry. Okay. All right. I've got Samina. It looks like
I just think it would be hard to put those priorities within the terms of reference. I think maybe the priorities that are in the terms of reference at present might need to be reworked. I mean, some of them do fit what the group needs to do. Maybe the data one can come out. Improving data, I won't see that as the role of this group, unless, because we said that we changed the title to service user and carers and health inequalities. So we do need see if this is the best place, or just keeping track of what's happening. So I think in the light of recent developments since these terms of reference have been put into place, namely the input of Natalie into the State of Inequalities Action Plan, I would suggest, Chair, that if you if possible, if I can just reword some of these this week in light of that, and when I do my bit after, it might become clearer.
Okay.
Okay.
So on the terms of reference, I've had no other feedback then.
Yeah, and I think that's helpful then, I suppose. I mean, Joe, if there isn't any further feedback, maybe the only changes that we need to make then would follow the discussion that we're going to have with Samina. And Samina, thank you for that offer to make some sort of slight amendments to those terms of reference. So thanks for that. So we're not able to agree the terms of reference today because of some of those additional changes that we may need to make to the terms of reference. That's fine. Thank you. So shall we then go to your item then on the agenda, Samina, before the priorities, and maybe what we'll do after that, we'll go to the service user involvement and engagement, because I realized that Joe needs to leave. Joe Scott would need to leave before 1 o'clock, and then we'll end with the priorities. Thanks.
Okay, thank you, Chair. What I will draw your attention to is the action plan, which was on the back of the State of Inequalities report, and that goes to quality and safety next week. It's been to PET, and it's had input from the executive as well as Natalie Fox. So when we did the action plan, there was loads of actions with my name all over it and the team. And when it went to PET, they felt that it needed to be embedded. I did go to the managing directors group as well as the POMG as well. So Natalie had a look at the action plan last week and fed back, and there's a few areas which she felt is the role of this this work stream. So PCREF, she does see that as a role of this group, even though we are looking to set up a subgroup of this group to focus on it because there is a framework. There will need to be some discussion, probably higher up in terms of at a strategic level where we can have those conversations around what comes through the PCREF. So the three elements of PCREF, one is making sure that there's leadership and governance to make sure that it's happening. Two, which is the organisational competencies and cultural practice change that will have to happen across services to be able to respond to it. And three is the feedback mechanism, the patient and carers. So Natalie did feel that some of these elements were tied to this group. And as you can see there, the setup of PCREF is one of the actions that need to happen. So that's one area which we already discussed is one of the priority areas that we need to keep an eye on as part of the terms of reference. The second area was the overrepresentation of protected characteristics in secondary care. So there's a lot in there about raising awareness of overrepresentation across divisions, but also the role of divisions to signpost to other services. So that does mean them working more closely with their partners at that place level. Now, Natalie did feel that this was an area that the service user and health inequalities work stream need to keep an eye on. So even though, you know, service users and carers, we've got some mechanisms internally by experts by experience and service users and carers. There's also the element of that community links with BCSR sectors. So we're not advocating they join this group, but it's how those divisions are building those networks with them. And I'm happy to have a discussion outside the room around that. So for that area, in terms of changing the trajectory of people being in secondary care and using more community services and other services with our partners, she does see that this group to be a key role. And as you can see, one of the deliverables for this year, academic year, is to be increasing that signposting to the front door model. And I don't know where each division is on that. There may be more strengths in some divisions compared to others, and that is something that we might need to look at. Also, as you go on over the next 2 years, you know, to be able to influence the community champions program. So they're quite developed in Haringey and Enfield, and the focus there will be how we can influence them to diversify and be more representative, but also establishing those stronger links with community champion programs or the equivalent in across the 5 boroughs. And I think those were the key areas that were identified.
Could I just encourage everyone to just go on mute, please?
Yeah.
So I can hear some feedback. Sorry.
I can talk. I mean, I don't have to give any feedback anytime soon. So.
I think someone's got their mic
Ben,
on.
Oh, he's gone on mute.
Yeah,
sorry, that's fine.
So I think those were the areas, and what I'll do is I'll make sure that they're reflected in the terms of reference. But I'm happy to have a chat with yourself and Joe outside this meeting, and I know there's going to be ongoing dialogue with the other managing directors and at POMG to make sure we're embedding this action plan across all the divisions. So I'm happy to take any comments, etc.
Yeah, thanks for that, Samina. I know Joe would like to come in. I guess I've got a question around what would be the functions of the subgroup. So we felt that we needed some focused work to happen via a subgroup.
Yeah.
And so it would be really helpful to know what are the elements that we need to cover here as the main sort of steering group around this, but actually what would be the subgroups focus on PCREF, yes.
So as I sort of stated, that there's 3 elements of PCREF. One is to ensure that we've got that leadership and governance to make sure that we're overseeing the work. And there's 3 elements, obviously the governance part and the leadership, the cultural competency element, and the feedback mechanism, which I expect this group to be key for that. So there does need to be a focus group just looking at the requirements of what needs to be embedded around PCREF to make sure we're on track. Not only that, by December we need to submit our plans nationally around PCREF. There is a national workshop as well, which is coming up. I don't know if Jordell can remind me of the date or put it in the chat, which I know both Amanda and Natalie will be attending, and I would encourage all managing directors to sort of, if they can, timetable that in. It is a virtual event, so they can understand more around it. So for the pilot sites that have had PCREF, their governance structures around PCREF has been quite extensive and quite substantial. So we are starting off, but I envisage we will probably need a strategic group, maybe aligned with the forthcoming EDI programme board, or at this level, to make sure that Amanda can sit on that group as the SRO of PCREF to take some of those strategic issues forward. So I don't think it would be appropriate, even though she will be coming to the group under this, for Amanda to sit on that group as the SRO for PCREF. It would have to be a strategic group, but I think it will evolve as we work through PCREF. But the starting point will be to have that group to deliver on the ask for December. I think Jordell's on the line, and I think if there's anything that I've missed and you'd want to quickly come in to clarify, Jordell, happy for you to jump in here.
Great, thanks, Amina. So I was just putting the NHS England PCREF national launch invite in the chat. So as part of the patient and carer race quality framework, so there's a national PCREF launch framework, and then as a partnership, as an organisation, we will be expected to have our own plan about how we'll take forward our work, combine the work we're already doing under the PCREF umbrella. And so it will need to be embedded. There are 3 aspects. So there's leadership and governance, patient and service user communication, and then there's also the actual things that we'll be doing. So all of that will need to be embedded in structures that we already have. And having reviewed the different governance structures, it was felt that the Health Inequalities Service User Forum that this is, that having a specific PCREF branch underneath that would fit in nicely to our already existing governance structures. And yet, as Samina had said, we will need an actual implementation group. So that's people who will be doing the doing, taking it forward. So we'll need representation from all of the divisions. And then there also needs to be more strategic oversight level to it, which is where Amanda would come in, and managing directors as well, just to make sure that things are aligned and being taken forward across the partnership.
That's fine. Thanks for that. That's really helpful. I'll let Joe come in, and then maybe just try and
Thanks.
summarise this conversation. Thank you.
Yes, please. Thanks, Prosper. It was just really to say that have we got a format for each of the divisions to follow? Because Erasmus was here for Enfield with us, and I see Jess and Haringey, etc., and Barnet. But is there a format for us to follow so that we're not starting it all from scratch and we're not all doing it differently?
Yeah, and I think, sorry, I was just going to say, one of the opportunities to look at that is linked to the event that Jordell will talk about later, the Tottenham event, where all divisions are invited to look at what has happened at Haringey and to reflect on their own models that are happening in each division to see if there's any gaps. Is there something else that we can do? I know I had a brief conversation this morning with Emma Whitby from Islington Healthcare Health Watch, and she again was very keen to know what was happening within Islington division around, for example, over-representation. So we do need to start connecting the dots, look at what's happening, where the gaps are within each division, and have a plan of how we can bridge those gaps and learn from good practice. So I think we're not starting from scratch. I think we probably need some focus time to look at what's happening and to articulate that as part of the planning.
Thanks, Amina. It's helpful.
And so I just also add South London and Maudsley very quickly, so South London and Maudsley, who have been part of the pilot sites. So they've got Lewisham, I think they've got 4 boroughs in total. And one of the parts of the framework we need to focus on is organisational competences. And they've taken it borough by borough, so they've taken a different one. So again, once we've had a chance to reflect on what's going on, what we're looking at, then that will be the opportunity to say, oh, Haringey is doing this really well, continue. Enfield, you're doing great work here. So yeah, this is where we would need to make those decisions. Thank you.
And I just wanted to quickly add that although the focus is on race for this particular framework, it will support with all the other protected characteristics, because if we can get it right there, it'll help us to think about where some of our gaps are with other protected characteristics of vulnerable groups. So I just urge people to not sort of look at it as a tunnel sort of thing, but it can, it's a blueprint in terms of what we need to do for other groups as well. Thank you.
Yes, thank you for that. And I think we're going to go back to sort of Joe's question, really. It would be helpful if there is any guidelines for the divisions. And so, Jordell, Samina, if there's anything that you can share, certainly I'm hearing about the great work that's happened in other places, obviously Haringey and Enfield. So clearly it will be helpful for us to take that partnership approach. I mean, especially if you're looking at things such as over-representation, I'd like to see if there's anything that we can learn. And I'll be absolutely honest, from an Islington point of view, probably there hasn't been a lot happening in that space. So this is why I think it would be important for us to share and obviously provide some of those guidelines. And I'm sure some of it will be covered at that event in Tottenham. So that will be great. Thanks for that. So I guess we've agreed then that those areas that you've highlighted in yellow, we are going to make sure that we've got oversight at this group. I'm still not clear around the subgroup or the focus group that Jordell, you've agreed is sort of doing the do around ICRIF in terms of the membership for that. What do you need from the divisions, I guess, around the membership for that group, and what are the timescales? So if you could clarify that for us, so we can go back to the divisions and ask for membership for that group to be set up, that would be great.
Yeah, in terms of timescales, I think at the NHS England launch event in November, we'll know more. To be honest, they've only given us a draft plan and we've worked with what we've got. They've said that we need to have our partnership plan by December. So yeah, it'd be really great to clarify that. But in terms of people doing the implementation of PCREF, I'm conceptualizing service managers, because when it's looking at things such as organizational competencies, that could, for example, be training delivered to staff, that could be, improvements for service users and carers in terms of, having advocacy, having culturally appropriate meals, having care planning. We will need to be guided by the priorities that come out of PCREF. So again, we'll know further and be able to fine tune once we've got the priorities and the timescales by NHS England. But yeah, I'm envisioning definitely service managers, community leads, or service leads.
Yeah, and that's helpful. And just checking really, because I did hear that we may have to start reporting sometime this year. So if the membership and this particular subgroup can wait until November, does that mean that we're not expected to be doing any external reporting?
No, not yet. Again, NHS England will clarify when we'll need to do our reporting. They've just said we need our plan ready by December, and we're in good shape. We've got, as I said, draft governance structure, and then so once NHS England have given us their set dates for reporting, we'll cascade that. Yeah,
that's great. Thanks, Samina.
I just wanted to quickly come in there. I think even though the plan needs to be ready for December, as we know, it will need to go through internal governance. So it'll have to go through PET, it'll have to go through quality and safety and some sort of sign-off before it's submitted. So even though that event's in November, what we need to start looking at is that framework and exactly what we've been talking about today. Where are those gaps? We might need to do something, whether it's a workshop, inviting the divisions or part of POMG. I can take it there to request it, Prosper. So we could have some sort of workshop where we can identify some of those gaps and then have some sort of draft plan ready, which we might need to enhance once we've had that in November workshop at that national level. But I wouldn't wait for that workshop. I think we need to get cracking with what our action plan is going to be looking like to deliver PCREF. So hopefully maybe this event later on this month at Tottenham might be a starting point, but maybe a focused group to just flesh out what is happening, where the gaps are. You've already highlighted things need to be strengthened in Islington. How would that happen, etc. So we do need to maybe have those conversations earlier than later.
That's fine, and if you could have that discussion, Samina, with Jodelle, and if you need to involve me and Joel, then let's do that, and it'll be helpful for us to start thinking about who in our divisions can help us with taking this work forward. So thank you for that. Okay, so let's move on to the